My name is Dr. Lewis. I'm a psychiatrist at anxiety.pw. This anxiety clinic is one of the biggest online psychiatric clinics in the United States. Let's talk about toxic relationships of borderline personality disorder and how to deal with them. Toxic relationships involving individuals with borderline personality disorder, BPD, can be challenging and emotionally taxing. People with BPD often struggle with intense and unstable emotions, difficulties in relationships, and a fear of abandonment. This can lead to problematic behaviors that can make relationships tumultuous. Here's how to deal with toxic relationships involving someone with BPD. Educate yourself. Understanding the symptoms and characteristics of BPD can help you navigate the relationship more effectively. It will also help you differentiate between the person and the disorder, fostering empathy and compassion. Set boundaries. Establish clear and healthy boundaries in the relationship. People with BPD might struggle with boundaries, so it's important to communicate your limits kindly but firmly. Stick to these boundaries to avoid enabling negative behaviors. Communicate clearly. Effective communication is key. Use I statements to express your feelings and concerns without blaming or accusing. Be direct, empathetic, and non-judgmental in your communication. Practice active listening. Listen actively and attentively when the person with BPD talks. Validate their feelings and emotions, even if you don't necessarily agree with them. Showing that you're genuinely interested can help build trust. Stay calm. People with BPD can sometimes experience intense mood swings and emotional outbursts. Stay calm and composed during these moments. Responding with anger or frustration can escalate the situation. Don't take everything personally. It's important to remember that many of the behaviors associated with BPD are not personal attacks against you. Their reactions are often driven by their own internal struggles. Encourage professional help. Suggest therapy and treatment for the individual with BPD. Dialectical behavior therapy, DBT, is often recommended for managing BPD symptoms. Professional help can provide them with tools to regulate emotions and improve interpersonal skills. Self-care, caring for yourself is crucial. Toxic relationships can be emotionally draining, so make sure you're taking care of your own mental and emotional well-being. Seek support from friends, family, or a therapist. Avoid manipulation. People with BPD might engage in manipulative behaviors to avoid feelings of abandonment. Be aware of these tactics and stand your ground while still being understanding. Know your limits. If the relationship becomes consistently harmful to your well-being, it might be necessary to reassess whether it's healthy to continue. Sometimes, maintaining distance or ending the relationship might be the best option for both parties. Practice patience. Recovery and progress for someone with BPD can be slow. Celebrate small victories and improvements, and be patient as they work towards better managing their symptoms. Support groups. Connecting with others who are dealing with similar situations can be extremely helpful. Support groups provide a safe space to share experiences and gain valuable insights. Remember that dealing with toxic relationships involving BPD requires a lot of patience, empathy, and self-awareness. However, it's essential to prioritize your own well-being as well. If the relationship becomes overwhelmingly toxic or harmful, seeking guidance from a mental health professional can be beneficial for you and for the person with BPD. For updates on anxiety topics, please subscribe to our channel. To make an appointment, please schedule your appointment on anxiety.pw.